Okay. So hey guys, this is a new YouTube channel. It's called All Round Health Topics. So here we're going to be talking about every possible health topic we can talk about, at least the basic information that our viewers are supposed to know about different health issues and especially about their health. So we are two doctors, we are general doctors and we're Nigerians. So this channel is actually inspired by the health situation of Nigeria. Being in Nigeria, we've seen that people do not have the right information they're supposed to have about their health situations. People don't have the opportunity to ask doctors questions, or they don't even know what they're supposed to be asking the doctors. Sometimes they don't know what medicine they've been given, what disease they have, okay, what caused it, how they can prevent it. So basically this channel is going to be touching on all that, so we can help the people know how to communicate with their doctors. So what we want try do now to contribute our own quota to make our country better, because every day our country just they get worse, and we no go leave everything for government. They shout government, everybody getting part to play. So as God help us, we study medicine, we be doctors, so we want to do our own part. We want help the people of Nigeria. So we want to teach people, we want to educate people about normal things when they supposed know, small things when you supposed know about your health. Questions when you supposed to ask your doctor, which medicine they give me, and wetin cause my disease, how I fit prevent them. Okay, this kind of small changes when we feel they do even for our house to better our health situation. So that's kind of thing we go they teach for here. So Mona try to subscribe to this channel. Mona leave una comment if you get anything we una want talk about, any health situation, any sickness we una get, we una want to get more information about, una fit leave am for the comment and we will talk about them. So generally we're going to be dropping these videos every week, and we're going to be talking about different topics. So today I have with me here
Dr. Celestina.
Okay, so I'm Dr. Onyinye. So like we said, we are Nigerians. So today we're going to be talking about what you should ask your doctor as a patient. Okay, there are certain questions that you should be able to ask your doctor when you go for consultation. So those are the things we're going to be touching today. Number one, you need to know your diagnosis. Okay, so many people are going to hospital, doctor is giving them medicine, doctor is telling them go and buy this one from pharmacy, and they no know wetin dem get. Some people they go chemist no be doctor, chemist no know wetin you get, chemist go tell you say na malaria. Sometimes no be malaria, any small thing you get to Nigeria na malaria. So you need to be able to ask your doctor, what is my diagnosis, what do I have? Okay, because once you know what you have, now from there we fit start. Okay, so I know wetin I get now, how I fit prevent am, wetin cause am, wetin I suppose stop to dey do, and wetin I suppose start to dey do, so that my life, my health go better. So asking your doctor about your diagnosis is important. Sometimes the doctors go tell you good and fine, but some doctors be like say they rush or they forget, they remember tell the patient wetin you get. So if you go consultation room, doctor finish, no tell you wetin you get, you ask am, abeg oga sir, wetin I get? So you ask am wetin you get, make him tell you. So from there now we will come be able we will come fit move forward, so we know how to better our health.
Yeah, another thing that I feel we have to ask our doctors is the cause of what we have. Like most times doctors don't really have time to like sit down and like, you know, discuss with you, talk to you, or educate you about what caused what you have. And I'm going to be talking about cause and prevention because they go hand in hand. Many diseases are preventable and others are not. Many diseases are caused by one thing, others are caused by other things. We need to know what caused this. Why am I here in the first place? And you have to be able to ask your doctor these things. He has to be able, or she has to be able to explain to you, okay, you have this. Now wetin cause am be that. You suppose ask your doctor, wetin cause this thing wey I get now? Like I wan know, I fit prevent am, you know, can I prevent this thing? You have to be able to ask, because you as a patient, you have the right to ask, you have the right to know. You have the right to be able to sit down with your doctor and say, okay doctor, I need to know, why am I here? What did I do, or what caused what I have? your doctor has the obligation to explain to you that, okay, you suppose they do this thing, not be this one. So they do that one, not be that one. We're supposed to ask. We're not supposed to be scared. Like I hear some people say that, no, I'm scared. He or she might get pissed off. He's your doctor or she's your doctor. They are not supposed to be getting pissed off. It's their job, it's their profession, and quite frankly, they took an oath. So they are supposed to be able to attend to you in the best possible way, right? In the best way possible. So you have to ask, what do I have? How can I prevent this? What can I do differently? I think it's for your benefit, and I think that it will help you on the long run. Instead of you going to the hospital this month, you're in the hospital, next month you're back in the hospital, another month you're in the hospital too, like say you be permanent client or waiting. I don't know, especially for the people who go to private hospitals, it's like you're feeding their generation. Every day you're visiting them. It's not supposed to be like that, especially for something that you can prevent. So that's another question that is very, very important. We need to ask. We need to discuss about stuff like this. We need to talk about issues, because it's better for a doctor to attend to 2 patients and these patients go a long time without needing to return to the hospital than for you to attend to 100 patients and every time these 100 patients keep coming back, they keep returning to the hospital for the same thing that is preventable. Like, I feel like it's not supposed to be that way, and I feel like you as a doctor, your job is not well done if your patients keep coming back to you all the time for something that is preventable. If it's not preventable, then well, that's another case, but at least for the preventable ones, we need to educate ourselves. We need to know why, what caused this, what can I do differently so that I don't keep coming back for the same thing.
Okay, so another thing that you need to ask your doctor is, what medication is he giving you? Okay, so sometimes they give you medicine and they are not even telling you which medicine they are giving you. They don't write the name. Sometimes they give you a sachet and they draw strokes, 2, 3, 4 strokes, depending on how many you're supposed to take. Okay, they don't tell you the name. It is your right as a patient to ask the doctor, please, what medicine are you giving me? What is the name of this medicine? So there are many reasons why you need to ask, because you can get an allergic reaction to that medicine, because you could have a side effect of that medicine. So if you don't know which medicine you have, you don't know what is wrong with you. Sometimes you would think that it's the same sickness that is worrying you, but not be the same sickness. So now the medicine said they cause them. So at least you need to ask your doctor, which medicine is this? What's the name of this medicine? How does it function? Self ask them. Okay, like na my liver I go, if I take am too much it go affect my liver or it go affect my kidney. Like those kind of questions, you need to know what medicine are you taking. If you know what medicine you're taking, then now you can look forward to, okay, what side effects or what allergies, which is what we're going to talk about next.
Another thing we need to know is that we have to research. It's very, very important when it comes to knowing. For you to know, you have to look for, right? For you to gain knowledge, you have to look for it. Most times we go to the hospital and they tell us, okay, na high BP you get to. Someone doesn't even know what high BP is. They say, okay, they take your blood pressure, give you drug. Oh yeah, take this one, morning, afternoon, night. We go home. What do you get? Na high BP. Okay, what do you do? Like, high BP is a very, very popular disease in our population right now, and like, it's something that you can't just take lightly, because it affects your life, it affects your lifestyle, it affects the people around you. And this is something that is not communicable, which means you don't transmit it unless maybe if by genetics, which plays a very big factor in high BP. But it kind of becomes your lifestyle, it kind of becomes part of you, because you live with this thing for a long time, and you have to be able to talk to your doctor about, how do I live with this, what do I do differently? Because having or living with high BP, you have to make a lot of changes. No, you need to dey chop drug every day. No, you have to make a lot of changes. Your diet, your lifestyle, what you drink, what you don't drink, what do you exercise, do you not exercise. So you have to be able to talk to your doctor about things you can do to live with high BP. That's just an example. So I feel like we have to research, not just high BP, lots of other drugs, other diseases. You have to research, you have to know. You go online, okay, they say na high BP I get to, wetin be high BP, eh? You read, okay, you form question, okay, next consult, because if you have high BP, you are going to be going to the hospital like frequently, periodically for checkups and stuff. So you have to know, you have to form questions. Okay, doctor, I don't understand this now. I was researching about this stuff. Okay, and I need to know more about this thing. How do I live with this? What do I do differently? Because it doesn't just depend on chopping drug every day. Like, it doesn't depend on just drugs. There are a lot of other things that you have to do in order to manage your blood pressure. Like, we need to spend our time to research about things that actually benefit our health, things that actually benefit us. Not be just to follow social media, Bobrisky here, Files, the other side. I don't know. I like Files, but still, my health is better.
I like you. I follow you, okay? I follow you.
I like Files, but man, my health is more important, I need to know better about how to take care of it, So we need to research about this stuff. It's going to benefit us in the long run, and yeah, I think that's all right.
Okay, so not that you should stop following your celebrities or
follow them, but
as you're spending money on social media,
spend money on your health
your
take care of yourself.
data on getting more information about your health. Lastly, we want you to ask your doctors about side effects and possible allergies of the medications they are giving you. Every medicine actually has side effects, and people can have allergies to medicine. So if you take paracetamol now and I'm fine, she can't get allergy to the medicine. So everybody reacts differently to medication. So when they give you medicine, you have to ask your doctor, okay, doctor, what is the side effect of this medicine? Or what are the possible signs of an allergy to this medicine? Because some side effects are acceptable. So the fact that you're showing one of the side effects of a medication doesn't mean that you're going to stop taking the medicine.
Yeah.
But now when it becomes an allergy, you have to stop taking the medicine. So that's why you need to know, because sometimes they give you multiple medicines. So if you're having an allergy or reaction to something, you know which one you're reacting to. So you need to ask those questions, because most times we as a patient, we can help our doctors, because the doctor doesn't know what you have allergy to. He doesn't know what you've taken the last time you went to see another doctor. So when you're going to a doctor, you tell the doctor, okay, the last time I took this medicine, I had an allergic reaction. That's why you need to ask the doctor, what signs am I going to have that will tell me that I'm having an allergy to this medication you're giving me. Those are questions you need to ask. If you're not asking your doctor, maybe the doctor will not be the person who will give you the medicine. Ask your pharmacist, if it's the pharmacist that gave you the medicine. If not, if you're the type of person that likes going to chemists, which most of us in Nigeria we like very well because it's affordable, ask your chemist too. We know say chemists no be doctor. Chemists no be pharmacists. Chemists learn work from person wey learn work from person wey learn work from pharmacists. So chemists no know most times wetin e dey give you. E just know say if I add this one, and for this symptom when you tell me, e go work. So we need to ask this question, because people are dying. Nigerians are dying because we are ignorant to our health situations. So all these questions are questions we're supposed to ask our doctors or pharmacists or chemists. Okay? So this is everything we get to talk about this week. But next week we're going to be talking about antibiotics versus viral infections. Okay? Because Nigerians, we know ourselves.
We like antibiotics.
We like antibiotics. Any small thing, antibiotics. Not be everything you feel take antibiotics for. So we'll be talking about this next week. So watch out for our video next week. We're going to be posting every week.
Yeah.
We're doing this because we want to help.
We like you guys too
we
much.
need to help ourselves.
Yeah,
we need to help with
seriously.
our knowledge.
Rise by
Not to say
lifting
you will
others,
study
please.
medicine, you will keep unto yourself. We need to help each other. So we're doing this because we really want to help our fellow Nigerians and generally everybody out there that might have a question. So please subscribe, please.
Comments,
Leave your comments.
Yeah.
Thumbs up, please. Okay. And if you want to put thumbs down, give us a reason why you're putting thumbs up.
Yeah.
So that we can,
I feel like it's necessary.
so that we can get better now because like. We too will be JJC for this thing. We're just starting, so at least if there's a need for thumbs down, put the thumbs down.
Tell us why.
Reason so that we can get better.
Yeah.
Okay. Also share the link. Share the link with your friends, with your
families,
neighbors, your enemies, anybody who you see for a road, even a boss. Say, oh yeah, take this link. Then you go know how to better your health. Okay. So. We hope you've enjoyed this. We really hope. Please give us feedback.
Yes.
Please, we need to know if we are doing good or if we need to improve. There's always room for improvement. So
we actually grow every day. So we're human beings, we grow. Please just help us. Help us help you guys.
Help us help you. Yes, exactly.
Help us help you. I think that's the perfect phrase.
Okay, so
help us help you guys.
Thank you very much.
Thank you. Bye.
And thank you for watching. See you next week.